Dr Peta Stapleton here, clinical and health psychologist here in Australia and associate professor at Bond University. And mostly what I do in my research career is investigate the impact and the effectiveness of EFT, emotional freedom techniques, or tapping as you might commonly know it to also be. And have you ever wondered how long do you have to keep tapping for to actually achieve an outcome and one that will last over time? Well, we mainly research the area of food cravings and weight management, emotional eating, that type of thing here in Australia. And we have actually compared different treatment lengths to actually answer that very question. So I just want to talk about one of those publications today, and the full details are below in the video notes, so that if you wanted to read a little bit more, you can. This particular journal article is available in its entirety, so you can read it in full for free online. So what we did was we actually looked at the data from our original 4-week trials, and we always conduct 2 hours of tapping in our sessions. So over 4 weeks, that's 8 hours of tapping. For our adults that come along who are overweight or obese and have severe food cravings that are obviously impacting their emotional eating and their weight. And then as time went on, we actually extended that program to an 8-week program in order to make it comparable to other therapies, such as cognitive behavioural therapy. So the 4-week EFT program actually became an 8-week, 2 hours a week again, so 16 hours worth of tapping. And what we have been able to do is compare the data from the 4-week to the 8-week trial to have a look at when did people achieve their outcomes, and was there much of a difference between those two lengths of treatment over time. So we always do a 6 and a 12-month follow-up. So that's what we're looking for, to see whether or not those outcomes achieved in a 4-week program are still there compared to an 8-week at that 6 and 12-month mark. So like I said, you can actually read this in full. But just to summarise a little bit for you, what we actually found on every variable that we were measuring, and these were things like level of willpower or level of restraint that somebody had over food, indeed the severity of their food cravings, how severe they were, how frequent they were they daily, were they consuming them when they had a food craving, that type of thing. As well as things like depression, anxiety symptoms, stress symptoms, those types of things. So everything that we measured, and when we compared between the 4 and the 8-week program, we found there weren't any differences. Now what that actually meant was the 4-week program was actually able to achieve at a statistically significant level the same outcomes that the 8-week program did. So ultimately what that means is the 8-hour or 4-week program achieved the same outcomes. So as long as I guess the right things are tapped on, and obviously after 10, 12 years in this research space, we certainly know what to instruct people to do their tapping on for things like weight loss and weight maintenance. But ultimately the 4-week program was able to achieve the same outcomes. Now this may be beneficial for people if cost and time is actually a factor, that perhaps they can't access frequently certain numbers of sessions, or even indeed, I guess, trying to commit to an 8-week program and attending every single week may be problematic for people in rural and remote areas. So we do know, at least in this space, that 4 weeks or 8 hours worth of tapping over that 4 weeks was indeed enough to achieve the outcomes. Now, anecdotally, we did notice, and the therapist delivering the trials, that for some of our older patients, so those who are in their 70s and even into their early 80s, did benefit from a longer program. So those perhaps are things that need to be taken into consideration when planning the types of demographics or the participant demographics who may actually come to your groups or your trainings that you're running. That particularly for some of the older generations, they might well like a little bit longer to actually learn what they're learning and to implement it. We did also find some of the other variables that we were measuring, and restraint was one of them. That for the 4-week program, they indeed achieved that restraint outcome. The 8-week program actually was better at keeping that. There was no statistically significant differences at 6 and 12 months, but just things that are worthy of note that we noticed from a clinician's point of view. The other thing was that really stood out, and again, there were no statistically significant differences, but with the actual amount of weight loss that was lost, the 4-week program actually did lose more weight. So perhaps because they knew that the bookend of their program coming to an end was indeed 4 weeks later, there may well be a higher level of commitment for that. And they lost on average double the amount of weight and were able to maintain that over 12 months than the 8-week group actually did. So whilst both groups did lose a significant amount of weight, there may be differences there in how much time they have available, their level of commitment in getting the job done, if you like. So I hope you've enjoyed just listening. I'm sure in your own areas, or certainly other research may within time, compare for the same condition different treatment lengths just to see how they compare and whether or not shorter lengths are just as effective in EFT, in the world of tapping, as some of the others. I'm Peta Stapleton, and I hope you've enjoyed listening.